There's no doubt COVID panic has died down significantly, and we're going on with life as normal. It wasn't too long ago that we were braving the queues and proudly declaring that we'd been vaccinated against COVID-19. But just about 18 months later, chairs outside vaccination sites sit empty, and there's almost no talk of vaccinations or booster shots. Today on Health Matters, we look at life post-pandemic and ask whether we're a little too relaxed about it all. Now, as we go about life without masks and sanitizer, conversations around vaccinations and booster shots are nearly non-existent. We might still have the odd debate about the long-term effects of COVID vaccinations and trade those conspiracy theories about it, but it all seems to have taken a bit of a backseat.
We've seen a shift when it comes to COVID. With a wave 1, 2, and 3, because of the severe strain of the disease, more people were likely to be tested because everybody needed to be cautious not to spread the virus. And when it came to Omicron, it was party for everybody. We all got the disease. It was mild. We didn't need to go to hospital. And we didn't see a lot of deaths around us, although there were still COVID deaths associated with Omicron.
COVID stats are still being recorded. There are new cases every day, but our obsession with it seems to have dwindled. Now, even when people are sick, not everyone is testing for COVID. And if they do come down with the sniffles, they're putting it down to pollen, lack of rain, and just the weather in general.
We know there is a lot of under-testing, and there are various reasons associated with it. Because it presents itself as a mild flu, a rational person who's not feeling very, very sick is not going to go to the doctor to seek treatment, right? Because going to the doctor has cost associated with it. Even our members are not testing as much as they used to, and I think it's because they're not feeling threatened.
While many of us rush to get our 2 COVID jabs and booster shots, others haven't deemed it necessary.
Immunization has definitely reduced a role in the risk of deaths, because remember when we were vaccinating, we started with the first-line workers, and then we started with the older people with comorbidities. So we didn't see a lot of deaths in them.
But are we letting our guard down prematurely? Just recently, the World Health Organization warned that a decrease in new cases of monkeypox could be the most dangerous phase in an outbreak. So when it comes to COVID, should those who are undecided about getting vaccinated or getting their booster now just go out and get it done?
I would say we are not completely out of danger. So we must still be aware of it. If you have flu symptoms, better to treat yourself as a COVID and wear your mask, stay away from people, try not to propagate it, and still protect your elderly relatives and people that you work with and people that may be at risk.
One of the big fears around COVID has been the possibility of a resurgence or increase in cases when big crowds gather. So, with the frenzy of the December holidays fast approaching and the relaxed rules around COVID, does this danger still lurk?
As a country, we need to monitor our statistics in December to see if anything raises its head. But most importantly, the society also needs to do their bits. If you go into a mass gathering over the Christmas season, just watch out. If you do get a flu, better get tested or notify the people around you that you've got flu symptoms.
The WHO said it believed the end of the COVID-19 pandemic was in sight, but it also cautioned that the virus was still intensely circulating around the world and said it thought case numbers being reported were underestimated. The world body does expect there will be future waves of infection, albeit at different times around the world. But it doesn't believe this will translate into deaths, as the world now has effective tools such as vaccines and antivirals specifically for COVID-19. As we've seen with illnesses such as HIV/AIDS or SARS, there's a wave of panic and then it goes quiet, with the fight against these threats happening in the background. Many of us might look at COVID as the new flu and leave it up to our bodies to put up a good fight if we're hit. Whether you want to get vaccinated or a booster shot is still your choice. But as we prepare to let our hair down at the end of what has been a very challenging year for South Africans, it couldn't hurt to just play it a little safe.